Even though we're talking about renewal, we're also talking about something that continues to hang around.
And that's COVID.
Yeah.
And that's why we have Dr. Kenyani Davis with us. You've been doing so much. You said something interesting. This is now the new normal. What does that mean?
We all talked about what will the new normal look like, right? But guess what? We're in it right now. So this is what the new normal is. So whatever we do tracking forward, this is what it's going to look like.
Now we're 2 years into it, over 2 years. What has changed, and in the approach, and also the way we're dealing with it in the community?
Yeah, that's a great question. We know a lot more than we did 2 years ago. We actually have testing and we have a vaccine. But I always tell my patients, as we track into this new normal, there's a great acronym I like to use called SMART. Be safe, mindful, alert, reactive, and treatment. So we know the things that keep us safe, being mindful about big crowds and super spreaders, be alert if anybody else is sick, and now be reactive. We have testing all over the place. Now you can test, and we have treatments, many different modalities of treatments, some inpatient and a lot of outpatient treatment. So that's what's actually new now. We
had a lot of issues initially in underserved communities, and in the inner city and west side, east side. Are those still with us?
Absolutely. And you know, one of the things I keep reminding is that COVID isn't a disparity. COVID is an inequity. And so what that means is, as long as we have health inequities still present, we're always going to have these disparities that exist. So we're still there. We're still lagging behind in treatment. We're still lagging behind in vaccination boosters. We have some people who have had one shot, not even the second shot, really still struggling with boosters. So it's still really absolutely impacting our communities. And so we still have a lot of work.
So even though there are these mutations, is it safe to believe that with all these mutations, it's just going to lessen, so it kind of like fizzles out?
I wish. So with each mutation, it gives the virus the ability to either become stronger or different or evade some of our treatment options. So it's always going to keep us on our toes. So the thought is the better we get as a community, the better we get with information, the better we get with treatments. Hopefully we can stay ahead of it, kind of like we've been staying ahead of the flu.
Yeah, and we're all fully vaxxed, but still,
yes.
I'll have them at the ready as well.
In my pocket and my purse.
There you go. But remember to stay smart in it.
We appreciate it.
Right.
Thank you very much.
Thank you. I appreciate it.